Welcome to the Business of Government Hour TV, a video companion to our flagship radio program. I'm Michael Keegan, your host. What is the mission of VA's Office of Community Care? How is VA enhancing how it provides community care? And what can VA do better? I'll explore these questions and so much more with our very special guest, Dr. Baligh Yehia, Deputy Undersecretary for Health for Community Care at VA. Also joining us from IBM is Mark Newsom. Take a look, take a listen, download the entire interview at iTunes and at businessofgovernment.org. So, Doctor, what is the mission of the U.S. Department of Veteran Affairs' Office of Community Care? And what is non-VA medical care? And perhaps you can give us the history of this program.
The Office of Community Care and, frankly, the Veteran Health Administration, our mission is really to serve veterans. And we do that by making sure that we can provide them services in the locations that make sense to them. Unlike very other different healthcare systems, we follow where the patients are. We have veterans that live in every corner of the United States. And while we have about 1,700 specific facilities and sites of care, we know that there's many locations where we don't have a brick-and-mortar presence. And so in our office in community care, we develop strategic partnerships with community providers and hospitals and clinics to make sure that we can deliver health care to veterans. Today, we have about 500,000 different providers that are private sector or other federal partners across the country that are dedicated to serving veterans through our program. Now, the interesting thing about our office is it's a relatively new office, but the idea of partnering with private sector providers is not new to VA. We've been doing this for about 70 years. Really started strongly with our academic affiliates. Many veteran medical associations, veteran medical hospitals are actually close to academic partners, university hospitals, and we have great partnerships there. And so that really served as the nidus for developing this robust network that we have today.
Mm-hmm. So, Doctor, what are the top, say, 3 challenges you face in your role, in your position, and how have you sought to address those challenges?
Yeah, I would say that, first and foremost is that coordination of care. Last fiscal year, about a third of all appointments that VA delivered were outside of our walls. So that's a very high number. Only about 2 years ago, it was about a quarter. And so it's a rapid growth in our strategic partnerships and our delivery of community kind of private sector care. So to make sure that as that veteran, that patient goes through their journey from a VA doctor to a community doctor, making sure that they have the right information, they're aware of where they're going and who they're seeing, that clinician, that doctor in front of them has all the information they need from the VA to take care of them. And then kind of vice versa on the way back as they go back into the VA for other services. We know what happened in the community. We know what medicines were prescribed, what tests were ordered. And so that is really probably the biggest challenge. And frankly, that's a challenge that is faced by all of American healthcare today. American healthcare is becoming more and more integrated. There's more dependencies across the spectrum, and many large healthcare systems today are struggling with the same thing. How do you coordinate care? How do you integrate care across networks of providers rather than just within kind of the silo of one individual hospital? So that's really what I focus a lot of my time on. The other thing is kind of some basic management principles that large institutions and organizations have, which is what to standardize, what not to standardize, how do you allow for flexibility? And so we have a very large healthcare system, obviously, and so we're always kind of trying to seek that appropriate balance of what are the things that really need to be standardized to deliver a consistent experience for our patients, and then what are the things that really don't need to be standardized to allow for maximum flexibility to take care of that individual in front of you. So those are the things that I kind of continue to work on.
So, Dr. Yehia, I would like to explore your strategic vision and priorities. Could you briefly identify your current strategic priorities for the Office of Community Care, and what are your goals?
Sure. We at VA are really driving towards developing an integrated health network, and that really is a network that takes the best of VA and the best of the community. And so my role is really in that community space of how to identify those key strategic partners and how to integrate that care between the VA and the community. So really that's kind of what we're all aiming for, is a robust, high-performing, integrated network across the country. And our motto and our mission is in community care is really easy. We need a program that is easy to understand, that is simple to administer, and that it meets the needs of veterans and their families, our community providers that are our partners, and our VA employees. And so all the work that we do really revolves around our key stakeholders and making sure that we can improve their lives, we can improve their health, we can improve the efficiency of the system. And that's been kind of the key motivator and driver of all the work that we do.
As we look at eligibility, the current system has overlapping community care eligibility requirements. Can you elaborate on your efforts to streamline and consolidate these requirements?
Yes, we actually have, our goal in community care, as I mentioned, is to deliver that program that is easy to understand and simple to administer and meets the needs of veterans and their families, community providers, and our staff. To do that, we believe we need to get away from our 7 to 8 different ways of doing the same exact thing and get to one way. And that's something that we've been discussing and working and partnering with Congress for the last year and a half to 2 years. We actually developed a strategic plan, a vision to get there that actually takes these 7, 8 different ways of doing, for the most part, the same thing and creates one program with one eligibility criteria and one way of purchasing health care and delivering health care in the community for veterans. I think that will have some such great benefit to not only our veteran patients that use the program, but also to our community providers, our doctors that we work with in other federal bodies and in the private sector, that they only have kind of one way to interact with VA versus multiple ways that might be confusing to them. And again, from an efficiency perspective for government and for administration, it makes sense to have one way, one program that works, so that you are not kind of setting up different systems to administer more than one program.
And so all of this doesn't happen without contracting, federal contracting. And sometimes the federal contracting requirements create unnecessary administrative burdens for some community providers. Can you elaborate on efforts to improve the VA's flexibility to meet veterans' demand for hospital care, medical services, or extended care services? And are there plans to authorize VA to purchase care in certain circumstances through agreements that are not subject to certain provisions of law governing federal contracts?
So that is an excellent question. I know it sounds like a complicated question, but it's an excellent question, because we need to make sure, as I described earlier, we have to partner with community providers and hospitals and clinics across the country to best take care of our veterans. We cannot have a physical presence in every location. And so we have to be able to do those strategic partnerships as efficiently and as quickly as possible. And in some circumstances, going through the federal contracting process takes a long time. And we may be talking about a small group practice or maybe kind of a single provider shop. And they're not used to working that way with any other sort of health entity, whether it's a health insurance plan or other systems or even Medicare, another part of the federal government. So we're actually looking to leverage something called provider agreements, where we can actually enter into pretty quick but still robust kind of a version of contractual agreements with providers that make it more simple and more easier for them to be able to partner with us. And like I said before, this is so important because in many locations, especially in rural America, they may be the only game in town. And so we may be dependent on that surgeon, that cardiologist, that neurosurgeon, that radiology group to take care of our veterans. And if we can't work with them efficiently because there's some complicated process that they have to go through, it really does us harm. And so we've actually have proposed in our plan that I had mentioned before to consolidate all our care programs, how we can get there. And luckily, we've been working with Congress to try to give us that authority to be able to partner with these community providers.
Mm-hmm. So, would you elaborate on your efforts or on the efforts to position VA as a leader and innovator in healthcare redesign, and what specific factors make VA unique compared to, say, commercial health plans?
Yeah, we are going through this transformation that I think can serve as a model for many other healthcare systems that are going through transformation. Healthcare in America is going through a lot of changes today, and that has a trickle-down effect to ultimately to patients, but to the clinics and the doctors and the hospitals where they're seen. And we've been going through a lot of changes over the last couple of years that could those lessons learned could be helpful to other institutions. And in my mind, you have to think about two things, the what and the how. And as you go through changes, the what for us has always been about how do we make the care and the outcomes of veterans better? How do we make their experiences better? So we work on improving different steps along the veteran's journey through care, and all of our work is really focused on making sure that they get better outcomes and experiences along their pathway. So that's really like the what are we doing? We're working to improve outcomes and experiences. The how is also equally important, which is how do you get that work done in a complex healthcare system? And we're a very complex healthcare system, just like many other systems. And being able to leverage teams, being able to empower kind of the frontline staff to generate ideas, being able to disseminate best practices across our institution. So that how you get things done, of being able to generate some momentum, really create that burning platform, create a system that's conducive to implement a lot of changes is just as important. And we've been doing that for the last 2 years or so in the Office of Community Care, and are continuing kind of forward on at an even accelerated pace now. So I think we have a lot to share there about the innovation of actually getting change accomplished.
Well, thanks for watching, and be sure to join me next time on the Business of Government Hour TV for another informative, insightful, and in-depth conversation on improving government effectiveness. Until then, visit us at businessofgovernment.org.